We acknowledge the traditional owners of the country on which we are speaking today, the Gadigal people of the Eora Nation. We wish to recognise and respect their continuing connection to land, culture and community. We pay our respects to their elders, both past and present, and extend that respect to other Aboriginal people listening. This podcast represents a brief summary of the law relating to the issues raised and should not be relied on as a substitute for professional advice. Specific legal advice should always be sought in relation to any particular circumstances, and no liability will be accepted for any losses incurred as a result of reliance on this podcast by those relying solely on this podcast. Hello and welcome to Hicksons Health Hour, the podcast series that explores a variety of current legal health topics. Throughout each episode, you will hear from different members of our health team who have expertise in this area. We hope that you enjoy the podcasts and find these episodes valuable. Hello, my name is Rosslyn Cooke and I'm a partner in the health team at Hicksons Lawyers. Today, I will be discussing duty of care. Duty of care is the first element in a medical negligence claim. In this podcast, I will run through what the law says about duty of care, talk about the principles of negligence and relevant legislation, and then I will run you through a short case example to show how duty of care is relevant to proving a medical negligence claim. The four elements of a medical negligence claim are these: 1, duty of care; 2, breach of duty of care; 3, harm or injury and damage; and finally, causation. So as you can see, duty of care is the first element of a medical negligence claim. And I would like to give you an example of duty of care. A patient, a small boy, presents to the emergency department with symptoms of vomiting and abdominal pain. ED staff have a duty of care to triage the small boy appropriately, giving the correct triage score, and a duty of care to refer the patient for proper investigations and treatment in a reasonable time. In the small boy's case, emergency staff gave the small boy analgesics and formed a plan to observe him for any signs of deterioration. Moving on to the second element of a medical negligence case, and that is breach of duty of care. This may be established if the patient can show there was delay in triaging him or commencing treatment. The small boy's condition deteriorated. He underwent investigations which eventually led to surgery, but he says the duty of care was breached because it took too long for him to get to surgery. The third element is harm or injury, loss and damage. Here the patient must show that he suffered damage because of the delay in the triage or commencing treatment. In our case, at surgery, the small boy was found to have a twisted bowel, requiring a large section of his bowel to be removed, leaving him with short bowel syndrome and ongoing symptoms. The fourth and final element in proving the case is causation. Here, the patient has to show that the breach of duty of care caused the damage. In our example, the small boy has to show that the delay in triage or commencing treatment caused his loss of bowel. The causation argument is about whether or not the small boy would have had the same outcome even if there had not been a delay in the diagnosis and surgery. There is also legislation which governs medical negligence claims called the Civil Liability Act, which came into effect in 2002. The main effect of that act was to offer a complete defence in medical or professional negligence cases, if it can be proved that elements of the legislation are satisfied. These are, 1, that the professional or health professional acted competently, and 2, peer professional opinion via an expert report says that the way the professional acted was competent, and this is accepted by a wide body of his peers. A few other stipulations in the legislation about competent practice are: 1, the professional cannot be irrational. 2, there may be a difference of opinion in the views held by reasonable peers. And finally, widely accepted does not mean universally accepted. So those are the principles required for a medical negligence claim. Of those, first and absolutely the most essential element is duty of care. To make those principles clear, I'm going to tell you about the case of a young boy named Robert Gould. This is an actual case that went to trial and appeal. Robert seriously injured his thumb when throwing rocks in a stormwater drain. In fact, the damage to his thumb was so serious that Robert ended up having his thumb amputated. But I am getting ahead of myself. To rewind, Robert was not exactly forthcoming in describing what had happened to him or where and when the accident had happened when his father brought him to hospital. It was unclear when the injury occurred and whether Robert fell on a dry surface or in water. If water was present in the stormwater drain, it was unclear if the water was dirty. It was also unclear what the mechanism of the injury was, whether Robert fell on his open hand or something fell on his hand, like a rock. All of these considerations were important to determine what was the proper antibiotic regime, which of course relates to whether or not hospital staff breached their duty of care to Robert. The clinical notes at the hospitals recorded that Robert fell on wet cement. The fall did occur in a stormwater drain. So it's not surprising that the cement in the stormwater drain could have been wet. Whether or not there had been immersion in water was particularly important for the choice of antibiotic to be administered. An accurate history provided at the time of admission would have potentially assisted those treating Robert by prescribing correct antibiotics, and perhaps Robert would have gone to surgery quicker if the correct time of the accident was known. So what did the doctors do, and did they discharge their duty of care to Robert? The antibiotic regime became a significant issue at trial and has relevance to duty of care. Antibiotics were administered, but the question was, were they the correct antibiotics? Despite antibiotics and surgery, what happened to Robert is this. Infection developed in his thumb, and ultimately Robert's thumb had to be amputated. Proceedings were commenced against the hospital on the basis that it breached its duty of care to Robert. So what did Robert say was done incorrectly? What were his allegations of breach of duty of care? In summary, they were twofold. Firstly, he said that the hospital failed to administer correct antibiotics to him, and there was a failure to refer him to a specialist for debridement within 6 hours of arrival at hospital. Those allegations were supported by peer professional opinion for the plaintiff, which, as you recall, I outlined at the start of our talk. This is what is required by the Civil Liability Act. So what did the plaintiff's evidence say? The plaintiff served expert evidence of an independent emergency physician who was critical about the waiting time for surgery. He said staff should have administered gentamicin and criticised subsequent actions of the hospital staff. For example, in the hand clinic, this concerned picking up signs of infection. Now, the plaintiff had expert evidence, but so did the hospital. For the hospital, the independent experts giving opinion on competent professional practice were a hand specialist and a microbiologist. These experts gave opinion that the hospital's care and management was in accordance with competent peer professional opinion, and that therefore the hospital had not breached its duty of care. Whether Robert fell on a dry surface or in water led to a question mark around what pathogens Robert may have been exposed to, which in turn would determine what antibiotics should have been administered. The microbiologist said the antibiotic regime was competent. It accorded with the antibiotic guidelines, and he disagreed that gentamicin should have been administered. So what happened in the case? The trial judge found in favour of Robert and against the hospital. The trial judge found the hospital staff had breached their duty of care. This decision was based on the assumption that Robert fell in dirty water. This affected the category of antibiotics which should have been administered. Robert's expert, an emergency physician, said that gentamicin should have been administered, and the judge accepted this. The judge also dismissed the hospital's expert evidence of the microbiologist as being irrational, which, as you will remember, is one of those categories under the Civil Liability Act that I spoke about earlier. These following factors influenced the judge in his findings. Firstly, he said the documentation by the hospital was inadequate. The judge found no reference point to consider the effect of the delay, as hospital staff did not know when the accident had happened. You'll remember I said that Robert was not very forthcoming about how and when he had injured his thumb. Secondly, another factor which influenced the judge was the delay in surgical washout until the following morning after the accident. The judge found this should have occurred by midnight, and accordingly, again, a breach of duty on the part of the hospital was found. Inadequate administration of inpatient antibiotics was also found by the judge, who said that Robert should have been given gentamicin as a prophylaxis, and in doing so, he dismissed the hospital's expert evidence as irrational. Finally, the judge was not at all happy about the care of Robert in the hand clinic. The judge found that there were signs of infection 2 weeks after the injury, but there was no corresponding change in Robert's antibiotic cover. The judge found there should have been a broad-spectrum antibiotic added as a precaution at the hand clinic. The loss of his thumb was found to have been caused by a failure to administer additional antibiotics, namely gentamicin, on the evening of Robert's first presentation to the hospital. The duty of care was to administer adequate antibiotic cover, and the judge found that this duty was breached by the hospital staff in not administering gentamicin and not altering antibiotic coverage in the hand clinic. There was also a breach of duty of care by hospital staff in delaying the debridement surgery till the following day. So what happened next? The hospital was very unhappy with the finding of breach of duty of care against them, and they appealed. On appeal, the court found that the hospital's experts were not irrational. They discussed that it is two very different things to prefer evidence for certain reasons as opposed to finding the evidence irrational. On the issue of antibiotic administration, the Court of Appeal had to determine whether the hospital had a defence under the Civil Liability Act, taking into account the application of the guidelines for administration of antibiotics. The guidelines suggested administration of certain antibiotics in the case of a child with an open wound. Gentamicin was not one of the suggested antibiotics. The Court of Appeal found that the hospital's experts should not have been rejected as irrational and that the hospital's practice accorded with the opinions of their peer experts. Therefore followed that the Civil Liability Act applied, and the court found that there was no breach of duty of care and no liability and negligence by the hospital. This is a useful decision as it gives guidance on the operation of the Civil Liability Act, and in the context of what we're talking about today, what this means for duty of care and whether a breach can be established. I think we can learn some very useful things from Robert Gould's case. It shows how the standard of care is determined and that is by peer professional opinion. Your duty of care is determined by the kinds of considerations the court took into account, such as whether the care was competent and reasonable. This defines the duty of care. The decision also confirms that peer opinion must be widely accepted, but not universally accepted. It gives guidance on what irrational peer opinion means. It doesn't mean unreasonable, but it does mean whether the opinion is capable of withstanding logical analysis. The decision also assists lawyers like ourselves defending medical negligence cases if guidelines or similar evidence of widespread practice and procedure can be used to establish a practice. This goes to duty of care. Duty of care is owed by hospitals and their staff to most, if not all, patients. Whether or not the hospital breached that duty of care is where the focus will be in a medical negligence case. So how do we determine if there was a breach? We do this by reference to what peer professional opinion says was competent professional practice at the time the service was provided. The competent professional practice may be determined by the court with reliance on expert opinion. The degree of care that you owe to a patient is probably your number one issue of importance. Your care, in order to discharge your duty of care, must be reasonable and competent. You are not required to provide perfect care, although as your lawyer, I would very much like that. You are required to give reasonable care and skill, which the court will hold is competent professional practice. Whether your care is reasonable will depend on what your peers say is reasonable and what expert peer professional opinion considers was reasonable care and skill in the circumstances. So I wish you all the best in your practice and care of your patients. That concludes this episode of Hicksons Health Hour. Thanks for listening. We hope you enjoyed this episode. Make sure you listen to the rest of the series. If you would like to find out more, please visit hicksons.com.au.